With me is Dr. Helen Colen, a plastic and reconstructive surgeon from New York City on the staff of many hospitals in New York and in her own private practice, and also a patient who wants to be known as by the name of Susan. Susan has her own personal story that has to do with her breasts. Susan, you want to tell us what happened?
Yeah, I had always wanted a lift. I had several children, and I thought that my breasts looked like somebody had stuck a pin in them. So, I had discussed with
You had drooping breasts.
Yes. Initially, I had gotten a referral from my doctor to go to a New York doctor, and I didn't care for his prognosis. He said that I would have a lot of scarring, so I didn't have my breasts done by him. Mm-hmm. Now, I was visiting with some relatives, and I had seen this commercial on TV, and we thought it was the greatest thing. We saw, an ad advertising this doctor group. So my cousin was interested in the computer imaging. We called up and made an appointment. So
I remember a quote that you said. You saw it on television and you thought that if it was on television, then it had to be good. Is that correct?
Yeah, that's exactly
what I
thought.
Briefly, what happened when you went to this group and had the surgery done?
Well, I was impressed with the location. They were on the Upper East Side on Park Avenue, and the staff was very cordial and gracious, and the doctor was very impressive, and he said he did a lot of these surgeries, and particularly breasts, and it was one of the top surgeries done, next to noses. And he thought that he could do a very good job. He was very confident, and I felt that he was competent. And I made an appointment right away. He said that there would be minimal scarring, if any at all, and that's what really hooked me. And also that the surgery was done on site. Okay. So I made an appointment right there.
Now you wanted the breast to stay the same size, but not to droop.
Yeah, I wanted to stay a B size.
A B size. What happened?
Well, I went in and he did the surgery, and about a week later or two, he took out the stitches. And a week after that, the incision had opened. This was in February of '86. And the incision had stayed open until about June. It took all that time to heal and close. In the meantime, I did...
So 4 or 5 months you had an open wound? Okay.
Yeah, it was awful. It was painful, and, I was putting solution salve on it all this time.
Aside from the complication, what did your breasts look like?
Well, it was swollen, and I always had to keep them covered, and, I really didn't go out much, so my social life was non-existent.
Were there implants involved?
Yes, yeah, he did put the implants in. He made an incision around the nipple and down, and he put in the implants. And I believe he said he put them under the muscle at that time.
What was the next step? What happened?
Okay, so after that, it healed up. The breasts, it looked like they melted. So he said that he would have to do them over. They didn't take, that there was complications, and that I wasn't the candidate for this type of implant, that he would have to do it over. So I went along with it, and in August he did the surgery over again. And in the meantime, he made the incision underneath, and then inserted the implant, which happened to be a C size. They were very heavy, and I didn't care for the C. I never requested a C.
You wanted a B size, but not to droop, and now you've had open wounds for 4 or 5 months, and you've gone from drooping breasts and melting breasts to C-size breasts. Yeah. Dr. Colen, help us. Is this normal? Does this happen very often?
Well, basically what Susan had was a breast lift, which occasionally, unfortunately, when the sutures are removed, a wound can break down. She also had implants put in, which were put not under the muscle, but under the breast tissue. Now what happened with that is that she developed a capsule, which is hardness around the implant, which does occur, and unfortunately when you put the implant under the breast tissue, capsules are most noticeable, and they form more readily.
Do they look like the plastic packing?
That's right. They looked exactly like 2 tennis balls.
Oh, boy.
And what happens is that being the fact that she also had a mastopexy or a breast lift, when those implants were put in, they were heavy. And so one breast drooped more than the other. So she not only was asymmetric, but she had bigger breasts, asymmetry, bed scarring, and sensitivity.
I'm going to stop you for a moment because it's rather graphic. Susan, when you did have these capsules, these tennis balls in your breasts,
Yes.
how did you get rid of them?
Okay, it was very painful, first of all. I developed a lot of pain under my arms. It felt like I just delivered. So I went back to the doctor, and he and his nurse came in and said, oh, it's encapsulated. So they both grabbed one breast and squeezed real hard until it burst. And
Until
they did
they
the
popped
other,
the capsules in your breast.
And the other side also. And
Susan, tell us, where are you
It
now?
hurt.
Where are you now? Are you happy with your breast now?
well, that's when I had called up and gotten another referral and went to Helen because I really didn't want him to touch me at this point. My breasts were painful and big and hangy, and I really wanted to change doctors.
Dr. Colen, how hard is it to go back and fix something that someone has...
It is very difficult. Number one, you usually cannot do it in one stage. My plan with Susan is as follows. So we already did the first stage.
Could we... We're going to have some pictures on the screen
The
that may be
pictures are
helpful.
basically illustrations, and
Okay.
what the picture shows is unevenness of the breast with encapsulation, and since we cannot show the real photographs on TV, we got to settle for this.
What's the difference between the left and the right?
Where the nipples are in the wrong positions, you can see unevenness of one breast opposed to the other. One breast is lower than the other. Of course, you can't see the scarring on this illustration. But the question is, what are you going to do with these breasts? How can you make them look natural? Number one, you don't want them to be hard. You want them to be soft, like breasts should be. Number two, you want to have the nipples in the right position.
Can a breast after implant feel normal?
Of course.
So a husband or a significant other
Would not know that
would
it's
not
an implant.
would not know it's an
Absolutely.
implant if it was done properly,
Or if you don't have a complication.
or if you don't have a complication. At this point, can Sandra be happy? Can Susan be happy?
Susan could be happy provided that she knows provided her expectations are reasonable. As we discussed with Susan when she came, that we're going to try and do the best we can. My plan for her is the first thing that I did was removed the implant. I cut down that entire capsule out, which was under the breast tissue. I took a smaller implant and I put it under the muscle. That softened up the breast already. She's still uneven. At this point, I'll have to do another breast lift to even out her
breast.
nipples and her breasts.
This is a good point to take. We have another phone call. Let's go straight to that. Hello and good morning.
Hello, to Dr. Colen about the breast enlargement procedure, I have a few questions. One, if you get the implants, not only would I be concerned if it feels natural to another person, but how about yourself? Can you still sleep on your stomach and feel comfortable and not feel like there's something artificial inside you? Number two, when you raise your arms over your head, does it still look normal, or does it look like you have two round balls in there? And the third one, cancer. My mother and aunt have had mastectomies. Would I not be a candidate for that reason?
Number one, implants, when they are put under the muscle, and they have to be the right size of an implant. If a too big an implant is put in, it will not be natural. The right size of an implant for your skin envelope and put under the muscle will feel quite natural. The second question, when you raise your arms, it will definitely be natural, provided it's done correctly. You have to, when you develop your pocket underneath the muscle, you take great pains to make it symmetrical and equal. And at that point, when you raise your arms, you should not see it, especially if you put it through the armpit or under the axilla. The third question that you have, the implants are put under the muscle. They have nothing to do with your breast tissue. So they will not enhance or decrease the chance of getting cancer. And you are a candidate for implants because it will not affect the examination of your breast.
Susan, how you've had implants. How do they feel to you?
Well, when the other doctor did it, it was large and heavy. I couldn't run or play tennis. It really inhibited my activities.
But now that it's done right,
Now
is
that it's done properly, I don't feel them.